for the preparation for joint injections. Sterile gloves out of the packet. Steroid ampule. Local anesthetic vial. Betadine or chlorhexidine for skin disinfection. Selection of syringes for various tasks. 1 cc is used for local skin anesthesia, 3 cc syringe for small joints in the hand and feet, and 5 cc for medium joints such as the elbow and ankle, and 10 cc for large joints such as the knee and shoulder. Sterilized cotton for pre-injection disinfection and post-injection compression to stop bleeding. Skin plaster to apply post-injection. Sharps bin handy to discard all sharps immediately and safely. This task is the responsibility of the healthcare professional doing the injection.